Hi, Zoe.
Hi.
I'm Dr. KCC. It's nice to see you.
Nice to see you again.
Yes, I know we're here for your yearly physical exam, so we'll just get started.
Sounds good.
I'm going to go ahead and just verify some information. Go ahead and give me your first and last name.
Zoe K.
And Zoe, what is your date of birth?
January 7th, 2001.
Are you currently on any medications?
No, I am not.
Any allergies?
No allergies.
Perfect. Have you had any medical or surgical history that I should be aware of?
No, not that I can think of.
Okay. Are you having any chief concerns today?
I'm not sure. Just check up, make sure everything's good.
Okay. Okay, perfect. Okay, Zoe, since everything looks okay, we don't need to review anything. We will just start with your yearly physical checkup and making sure that everything is still the same as last year. Okay, Zoe, I'm going to go ahead and start with just putting some gloves on. We will begin with your blood pressure. Take your left arm. And you can go ahead and relax. Alright, go ahead and uncross your legs for me. Perfect. Perfect. Blood pressure was 122/80. It is a little high than usual. Is it just because maybe you're a little nervous today?
Yeah, checkups.
Doctors, absolutely. We will go ahead and check your oxygen and temperature. Perfect, 98 degrees. Okay, 98% oxygen, beautiful. I think we will just double check the blood pressure once we're into the appointment a little more, just to make sure it does go down, okay?
Sounds good.
reviewing everything again for you, Zoe. I have no allergies, no medications. From your last appointment, it looks like we did your lab work, your cholesterol. Your cholesterol looked normal. We don't need to do any colonoscopies since you're not of the age yet. Mammogram, no concerns, no children or anything, and not of age, so we'll wait for that. We did have your pap smear last year, so we recommend it every 3 years, so we don't need to do that today. And no worries for the bone density. Now, let's see, your tetanus and booster shot seems to be up to date. Did you want to get a flu vaccine today, or were you okay?
Maybe we can get the flu vaccine today.
Vaccine,
yeah.
Absolutely. And everything else looks okay there. Okay. As far as your personal medical history, is there any alcoholism or drug abuse that we should be aware of?
No.
No. Okay. Asthma?
No asthma.
Are you feeling okay at home? Any signs of depression, anxiety?
No, I'm feeling okay.
Okay. Do you feel safe at home?
Yeah.
Yeah, good. Let's see. High blood pressure, just a little bit today, so we're just going to double check that. But no previous concerns, so it should be okay. Are you getting any migraines or frequent headaches?
Nothing frequent or concerning.
Okay, perfect. And no recent surgeries. And do you happen to know the date of your last menstrual cycle?
It was 2 weeks ago, so
I can look at a
yes,
calendar.
Thank you.
Very welcome. Okay. Okay. And then this is in regards to your family history. I believe we completed it last time and everything seemed to be normal amongst the family, but just going through to make sure there haven't been any changes.
Mm-hmm.
So this would be for mom, dad, brother, sister, grandparents, alcohol or drug abuse.
No.
No. Any asthma for anyone?
No.
And then cancer?
No cancer.
No. And what about emphysema?
No.
No. Any depression or anxiety for anyone?
I'm not sure, but I don't think so.
Okay. Bipolar or suicidal?
No.
Okay. Diabetes?
No.
Early death? No. No. Heart disease?
Nobody I know.
Nobody. High cholesterol?
No.
High blood pressure?
No.
Kidney disease?
No.
Stroke?
No.
Thyroid disease?
No.
And migraines?
No.
And any concerns of any known family history since last?
Not that I know of. Thank you.
Perfect. Perfect family. All right. And as far as your social history, what is your occupation?
I work at a museum.
Oh, awesome. A museum. Museum. And what does the museum hold?
It's like history and artifacts about like ancient times and
Oh,
stuff.
wow. That's so neat. And what do you do in the museum?
I do tours and explain things to like
Oh,
kids
wow.
when schools come in and tours.
Oh, what a good job. So happy. Do the kids always have so many questions?
So many questions.
Okay, and is that a full-time or part-time job?
It's a full-time job.
Full-time, awesome. All right, and are those day shifts or night shifts?
Day shifts.
Day shifts. Okay, and your marital status, single, partner, married, widowed?
Partner.
Partner. And no children?
No children.
Okay, any tobacco use?
No tobacco use.
No. And already we know no alcohol or drug abuse. But do we consume any alcohol at times?
Recreationally.
Okay, absolutely. And how many times a week do you think you have a drink?
I would say a couple, like every like other week.
Okay, absolutely not bad. Okay. And I know you have your partner. Are you currently using any methods?
Oh, I have an IUD.
Okay, perfect. How is that feeling for you?
It's fine after it got settled.
Okay, good. And no complications?
None yet.
Okay. So bleeding is normal, no excessive bleeding or any pain or anything. Okay. And exercising, is that regularly for you?
Yeah.
Yeah. And what kinds of exercises do you do?
Mostly cardio and weights.
Yeah. Okay, cardio and weights. And about how long do you usually do that?
I would say about like 45 to an hour.
Okay. 45 minutes to an hour. And about how often during the week?
4 or 5 days a week.
Awesome. And on average, how many hours of sleep are you getting at night?
I would say about like 6 to 8 hours on good days, you know.
Absolutely. And how would you rate your diet? Good, fair, or poor?
I would say good now.
Good. Okay. And I know you said good now. What would you say is different from that?
I just got into healthy foods, you know, working out more, stuff like that.
Awesome.
So, yeah.
I'm happy for you.
Thank you.
Was there anything that caused you to do that?
Kind of boredom.
Yeah, absolutely. Well, I guess it's good to be bored.
Yeah.
Would you like any advice on your diet or anything?
Nothing I can think of off the top of my head.
Yeah.
If I come up with something, I'll ask.
Okay. All right. And then as far as safety, do you ride any bikes or anything, scooters?
Nothing really outside.
No? Okay. No. And then when you drive in the car, are you wearing your seatbelt consistently?
Yes.
Perfect. You have working smoke detectors at home?
Yes.
Okay, good. And I know you said no concern of violence. Do you have any guns at home, and are they locked up?
No guns.
Okay, perfect. Okay. And then are you seeing any specialists like cardiologist, gastroenterologist, OB/GYN, neurology?
No, not at the moment.
Okay. Perfect. And have you traveled outside of the country in the last 30 days?
No.
No. And I know I'm serving in the military. No. Does anyone in your family serve in the military?
Not currently.
Okay. Previously?
Yeah.
Okay. Okay. I think we have gone through all of our pre-screening requirements. So I'll just have you sign your name and put your date of birth. Thank you so much, Zoe. Awesome. We will finish our full body physical examination. We've already completed blood pressure, which we'll of course check in a little bit. Again, oxygen and temperature seemed fine. I'm gonna go ahead and just make sure there aren't any irregularities within the heart rhythm and also the lungs now. Before we do, I will have you go ahead and get into your gown for your full body assessment. Thank you. Okay, we're going to go ahead and check your heart. Okay, S1 and S2, no S3, so no worries about heart murmurs or anything. Now we're going to go ahead and check the lungs. I'm going to take a big deep breath and exhale. Perfect. We're going to do that 2 more times. Big deep breath and exhale. Okay. And 1 more time. Perfect. Air is flowing freely. No irregularities. Perfect. Okay. I'm going to go ahead and just check your scalp just to make sure that everything looks good on your head. No itchiness or anything that's been happening. Okay. And just evaluating your hair. It's very smooth, very healthy. Scalp seems to be normal color. No dryness, no flakiness. Okay. Perfect. Now I'll just do some palpations to make sure that I don't see any bumps or feel any bumps or anything. Palpate the face. Checking lymph node. Nothing swollen. No sinus pressure, which is good. Perfect. I'm going to go ahead and do a deeper evaluation of your facial skin just to make sure there aren't any other concerns. You haven't had any eczema or anything in the past?
No.
Skin flares?
I have, hormonal acne and stuff like that, but I don't think there's any concerning issues.
Perfect. Skin looks healthy. No dryness. Do you find that you have normal to dry skin, or normal to oily or oily?
I would say normal to oily.
Okay, perfect. Do you have a normal skincare routine?
Yes.
Awesome. And do you do that at night or both morning and night?
Both in the morning and at night.
Perfect, awesome. Perfect. No concerns. So the head looked awesome. We're gonna now check your ears to make sure everything looks okay. Have you been having any troubles hearing lately or anything?
No.
Okay, normal color membrane, light pink. No signs of infection, no perforations. It does look like the normal eardrum. Perfect. And same for this one, normal eardrum. Normal color. Let's go ahead and just check your eyesight. We're going to use the eye chart. So go ahead and cover your left eye. And can you read this line here?
DHJBS.
Perfect. And do it backwards.
SBJHT.
Perfect. And what about this line here?
LTFPH.
Good job. And what is this color?
A red.
And this color?
Green.
And what is this number?
9.
And this number?
5.
Perfect. Now go ahead and cover your right eye. And we're going to do the same thing. Go ahead and read this line here.
EPTCO.
And then if you can read this line backwards.
HPFTL.
Perfect. And what is this color?
A red.
This color.
Green.
And what is this number?
7.
And this number.
3.
And which one's smaller?
3.
Awesome. You are all set. 20/20 vision. No need or concern of any glasses. You're going to go ahead and check your scapulas. So your left and right scapula. Have you had any pain in this area?
No.
No. Okay. And I'm going to go ahead and just lift your arm out and up. Perfect. And then forward. And then as far back as you can. Perfect. Mobility seems to be good. No concerns on your left. Let's go ahead and check your right. And also no pain or anything. We're going to do the same thing. We're going to go to the side and up. Perfect. And forwards. And as far back. Beautiful. No signs of cracking. No joints are coming out of misplacement. So your scapula seem to be good. I'm going to go ahead and check your elbows. Seems to be reflexing as normal. Skin feels hydrated as visualization. We're just going to go to bench and open. Okay. Perfect. And we'll do this on the other elbow. Perfect. We're just going to check thighs to make sure everything looks okay. No pains or anything that you've been experiencing. Okay, both thighs feel normal. Perfect. It's going to check your left and right knee. See how the reflexes are going with those. No pain or cracking with the knees.
Like cracking when I walk down the stairs and stuff like that, but it's no pain.
Good, good.
Yeah.
So that's normal. Okay, so we're going to go ahead and just relax the knee. Okay, just palpating the knee. The bone feels normal. Tendons and muscles are normal, no inflammation. Same with this knee. Okay. Okay, if you had a little reflex. There we go, perfect. Check this one. Perfect. Perfect, okay. Reflexes are good. Okay. I'm going to go ahead and just take some basic measurements now that we're on this side. So go ahead and extend your arm, and just from the top of your scapula and down to your wrist. Okay. That was our right arm, and we have 21. We're going to do that with our left arm. Excuse me, that was our left arm, so now we're going to do it with our right arm.
I didn't even notice.
Okay, and that's fully extended. Okay. So this one was 20 and a half. So it seems that our right arm is a little shorter than our left arm. I'm just going to double check my measurements. Go ahead and extend your left arm. Okay, looks like that was my miscalculation. They are both 20 and a half. Okay. I'm just going to measure the circumference of your head. Okay, looks like it's 22. Sorry about that. to measure the thigh. Perfect. 15 and 15. And measure the knee. We're going to do the top of the knee here and down to the bottom of the knee. Okay, 5.5. And 5.5. Perfect. Okay, we are going to turn around and we'll just evaluate your vertebrae and everything as well. So is it okay if I go and put your hair up?
Yes.
Thank you. How does that feel?
Good.
Okay. And then is it okay if I go ahead and open your gown?
Yes.
Thank you. Okay. Feels normal. Skin is warm to touch. Normal skin color. No inflammation around the scapula. Then checking the cervical spine, starting with C1 to C6. Feels normal, no misalignment. And now we're going to go to the thoracic area, starting with T1 and going down. Feels normal. And heading towards the lumbar spine. Feels normal. Perfect. Okay. Check some measurements. Side. A little ticklish.
Yeah.
Okay. Feels normal. We're also going to check that on the other side. Okay. Your iliac crests do feel normal. No concerns. And to check your hip trochanters right here. It's the top of your hip area. No popping or anything when you walk.
No.
Okay. Okay. Hip feels normal. Okay, Zoe, to finish the assessment, I'll have you come to the front of the bed and we'll stand and we'll check the lower half. And then after that, your assessment is complete and you are welcome to go home. But don't forget to schedule the yearly physical for next year. Okay?
Sounds good.
Okay. Okay, Zoe, we're gonna now do the lower half, the knee and under. So we're gonna start with, I think, the right and left leg. Just making sure everything feels normal. Okay. 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 And is it okay if you go in and take your socks off? And we're just gonna make sure everything looks good. Okay, so toes look healthy. The toenails are growing in normally. No signs of fungal infection. No signs of warts. I'll look in between the toes. Perfect. And that's from your socks here, so no concerns. Perfect. The toes are cold to touch, which is normal because they're at the end of our extremities. But we did check your oxygen level, and that was on your fingers, which is the point. Because it is at the end of our extremities, it helps to make sure that the oxygen is flowing. So I don't have any concerns that your feet are cold.
Gotcha.
It's also getting colder out. So once we're done with this, I'll let you get your socks back on so you stay warm. Okay?
Sounds good.
We'll take some measurements. The bottom of the knee. 50. 50. Perfect. Okay. Okay, go ahead and turn around for me. Perfect. Okay, we're going to check the back of the thigh and lower leg. Okay, back of the thigh looks normal. Back of the knee looks normal. Nothing is inverted, so that's good. Now we're just going to evaluate the veins. Normal veins color is bluish purple. There's not too many, so we're not concerned that they're varicose veins. It's normal. Okay, check your lower tendon. No inflammation, normal. Okay, go ahead and lift this leg back. Thank you. Check the bottoms. Okay, normal. And we'll check this one. Okay. And looks like with the pressure, they were a little white, but turning back to a normal pink color. And no concerns. Perfect. Okay. Zoe, we are all set with your physical examination today, and I will see you in 1 year.
Thank you so much, Doctor.
Thank you.